And now on the line is Keogh from Fórsa. Catherine, welcome to the programme.
Thanks, Darren.
Catherine, we're doing this interview today on Near FM to talk about a serious issue I saw you quoted in the Irish Times about last week. To start off, though, on a more light-hearted manner, seeing as this is my first interview with you on your organisation, I have to say that as an Irish speaker, I love the name of your organisation. Can you tell me a bit about the history of how you decided on your name, and tell me how you are getting on with finding the new name?
Yeah, I'm happy to do that. So Fórsa came about when three unions amalgamated. So the three unions were originally Impact, CPSU and PSCU, and like a lot of organisations, our names were just a series of initials. So Impact was the Irish Municipals, Public, etc. The PSCU was a public sector executive union, and that's what our names were. So when we came together, it was a big moment in the history of Irish trade unions. It was the three public sector unions coming together to form one force as such. So we decided we wanted to have an appropriate name. So a lot of work was done with the members of those three unions, the original unions, to see what they wanted the new union to look like, what they wanted it to be called, and what they wanted it to stand for. And one of the key things that came out was that they wanted it to have a link to our Irish heritage, but they also wanted it to be meaningful in terms of what a union does. And what a union does is it stands up for its members, and it tries to put leverage on people. It tries to bring energy and momentum to situations to get better outcomes for workers. So a working group of union members was set up. They started looking at Irish words, and the one that resonated the most was Fórsa, which you know what Ireland is like, depending on what part of the country you're from, and who you speak to, they'll tell you it means either leverage or force, or some dialects it can even mean energy, but they all come back to the same idea. The momentum coming together to move things on. So that's it. It settled very well as a name. We think we made the right choice, and it fully came from our members. So yeah, it works out well. We're very happy with it.
Yeah, it's a great name. I love the name. Okay, to move on, can you tell me, Catherine, what exactly your job is with Fórsa and what your work entails? Your work personally, go ahead there.
Yeah, absolutely, Darren. Happy to. So I'm an assistant general secretary. Originally, I would have been a trade union activist, but I've been working full time for the union for 11 years now. I work in our National Health Office, and my remit is to negotiate nationally with the HSE, the Department of Health, and the big health sector employers around issues for our members. One of my main areas of responsibility is the area of Section 39 and Section 56. So I know I talk about it all the time, and I forget that people might not know what Section 39 agency is, but just for your listeners, the health service is in Ireland, everyone just thinks of the HSE part of it, but it's actually made up of a huge community and voluntary sector as well that's funded through the Department of Health and the HSE. The name Section 39 actually just comes from the section of the Health Act that set it up. So if you receive services in this country, if you go to say Beaumont Hospital or the Rotunda, they're voluntary hospitals under Section 38 of the Health Act. If you are accessing children's disability services, it might be through Enable Ireland, who are a charity that are actually fully private sector in terms of their workers and their conditions, but they're funded fully by the government. But they have to do some fundraising as well. Or you could get your services through St Michael's House, which is an independent organisation, but it's fully funded. Their staff are public sector. And then you have the HSE proper. So you have all those different component parts.
Okay, and to move on to talk more about what you're saying there, as I said, I read the article in the Irish Times last week that you're quoted in, and you said that they are part of the community voluntary sector in Ireland in respect of some services at least is on the verge of collapse. Can you tell me more about this, Catherine?
Yeah, I mean, it's very worrying. And just, from the unions level, obviously we talk about our members who work in these services, but it's also really worrying from a service user's perspective. So the way the health sector is currently set up, there's 3 tiers to it. So if you're in the HSE or in the Section 38, you're a public servant, you have public service terms and conditions, you have a public service pension, and you have a permanent job. So even just for simple things and such as applying for a mortgage, those things which are very important to most people at the moment, trying to get into the housing market, trying to get, to get access to rent in a property, all of that. Permanent employment is so important to it. If you work in the HSE or the St. Michael's House of the world, you're in a much better position than if you're in a Section 39 agency, which would be the likes of, it can be as big as Enable Ireland or as small as a community health group, with four workers. And some of the bigger Section 39 agencies would have pension schemes, would have good terms and conditions, but the smaller ones, and I think there's 250 organisations in Ireland there's actually 300 organisations in Ireland that are funded under Section 39 by the HSE. 50 of them provide 50% of the services, but 250 of them provide the other 50%. And you're looking at much smaller organisations who can't plan their services because they're in this third tier of funding. Their workers don't get the same rates of pay. The services themselves only get their funding on a yearly basis. And when it comes to then providing services for the service users, often who are the most vulnerable in our society, these service users, their services can't be planned other than for the next 12 months. And this is a huge problem. And what's happening, there's two elements to it. So the workers in these organisations are moving on as soon as they can into permanent employment in the HSE. I think one organisation that we deal with lost 33% of their workers in 1 year. So can you imagine the impact that would have on both the service and the people accessing that service? So that's the one element of it. And then as I keep coming back to the fact that they can't plan their services, the fact that the service users are there nervous going, will I be able to access this service next year? Will this organisation still be here next year? That's not right. And the government needs to face up to that.
Okay, I imagine though that this funding, the way the funding is provided, has always been the case. Like, why is this issue coming to the fore now, Catherine?
Well, I think you're right there. It's a historical issue, and that is one of the big issues. And it goes back to, if you bear with me, it goes back to the founding of the state. As a young state, and we're going back nearly 100 years now, we were a young state, we were a poor state. So the government of the times could not fund or supply all the services they need to. So there was the original outsourcing. They outsourced to the Brothers of Charity, basically to the religious orders. So if you look at the schools, and I know that's not what we're talking about this morning, but the patronage of schools comes up a lot, as in so many of them are still funded by the state but under religious order control. The same with the hospitals. The bulk of the big hospitals in Dublin are all funded through religious orders. The Mater, you'd see the debate about the National Maternity Hospital, and then the charity services. So a lot of children's disability services. So the likes of Enable Ireland, St. Michael's House, John of God's, a lot of them came about when parents got together, got a bit of funding and got bigger and bigger, and they were filling a gap that the state couldn't provide. So now, fast forward 100 years, and we have this kind of chaotic funding system that doesn't help us even as a society get where we need to get in terms of how funding works. And when I talk about the problems that are emerging now, me personally, I've probably been talking about them all. That's why I'm so delighted to get a chance to talk to you today and to your listeners, Aaron, because we've been talking about this in Fórsa for a long time. We had our conference recently and we spoke about it then, but this problem has not been tackled by repeated governments. They just ignore it. And a cynic would say it's because if you look at who access these services, the services that are funded this way can be drug treatment services, homeless services, children's disability services. So the most vulnerable in our society who don't have the power or the leverage to get things done, who don't have as many advocates for themselves. So it's why in Fórsa we're very passionate about raising this issue and bringing it to some kind of a conclusion that will work for the organisations. Just to give you an example, in 2017, the Minister for Health established a working group to examine the relationship between the whole voluntary sector and the state, because they could see the crack lines, the fault lines. They set up an independent review group. I think it was Catherine Day carried out that report. That concluded its work in 2018, and it said to the government of the day, there's an avalanche of deficits within the funding model. There's huge pressures for compliance on small organisations that they can't fulfil with their current funding. And they proposed, and back in 2018, that there'd be 3 to 5 year multi-annual funding. which would mean then that those organisations would know for the next 3 years or 5 years, we know what's coming in, we can plan our services. That still hasn't happened. The same group told the ministers to set up a forum for dialogue for the sector, which would bring like the stakeholders to the table. So organisations themselves, the service users, and from our position, the unions involved. But again, that forum has been limited to just the organisations. So all these, I suppose we need the current Minister for Health to take a grasp of this issue and tackle it once and for all, you know.
So when you said in the Irish Times last week that the community voluntary sector or parts of it are on the verge of collapse, like how is that the case now and it wasn't the case like in the past? It's a cumulative effect, is it?
It's absolutely that. It's historic underfunding coupled with the growth within the HSE itself, which is an ultimate irony, as the HSE has started recruiting more people. Naturally, that within the services we're talking about, Darren, you've got really skilled, really dedicated, highly trained workers that, you know, are really committed to their professions and to the people they care for. But they absolutely have to take the opportunity to get permanent employment, and that's so understandable. So you constantly see this really high turnover of staff, and the organisations are really struggling then to provide their services, you know, and that's why it's coming to a head now when we see this recruitment within the HSE. And it's a false economy, because the HSE then has to fund these organisations to go out and run new recruitment campaigns, new ads, new interview process, all that goes with it to try and bring in more staff to keep the services going. Because the other piece of it is the HSE, if tomorrow the voluntary and community sector said, you know what, we're out of this game, the HSE isn't in a position to take on all these services and to provide them.
And even if they had 3 to 5 year funding schemes, like that still would mean that they'd be able to take on people in full-time permanent jobs, would they?
There would be permanent jobs, but a lot of them would not have pension schemes. So ultimately, and I make no bones, and I'm not behind the door in saying this, like the ultimate long-term aim for ourselves and Fórsa would be that everybody providing a service on behalf of the state would be employed by the state, so that there would be no difference. I mean, Children's Disability Networks are an example. It's a really good initiative. And a lot of this is, you know, don't get me wrong, Darren, a lot of the initiatives that the Department of Health and the HSE are taking are really good. Care, you know, is a really important piece of work that will provide better health care for everyone. But if you look at, say, Children's Disability Networks, it's just a small piece. So that's a new way of working within children's disability. So there was work done by the HSE and by the partners in Section 39 and Section 38, and they realised that depending on where a child lived in Ireland would depend on what kind of services they got. And that's not right. Any child with any kind of a disability should have access to whatever services are available. So they came up with a national programme to change this, and it's starting to kick off now, where everything will be done on a network basis. So say we take North Dublin as an example, there's going to be 12 networks. There'll be geographical networks, and within that network there'll be a children's disability manager, and they will manage the work of everybody in that geographical area who provides services to children with disabilities. So that would mean before you might have to go to St. Michael's House for one service, and you would have to go to the HSE maybe for speech and language, or you would go to St. Michael's House for access to a special school, or you would go to Enable Ireland for physiotherapy, or the CRC for something else. So now within each network there will be one person, and it makes sense to me, and I think it makes sense to the parents, the children who need these services. There will be one person coordinating all the services that your child needs within that area. So it won't matter to the child or the parents whether this service is coming from a Section 39 agency, Section 38 or the HSE. That will be managed, and they will get access to all the services. But behind that, for that to work, it has to have people working on the same terms and conditions, to the same standards. You can't have, and you shouldn't have, you know, the person who's providing the service on behalf of the community or voluntary agency worried that they won't be there next year. That's no good for the child receiving the service, and it's no good for the worker providing the service.
This is the Progressing Disability Plan, isn't it?
Yeah. So that's starting at the moment. And again, depending on where you are in the country, it's it's in some areas it's further advanced. It's quite advanced in North Dublin. I think it's St Michael's House, the CRC, the HSC are the main agencies and that provide the service. And so I think I mentioned there's 12 networks. So some networks will be the CRC will lead out on, some networks the HSC will lead out on, but and some St Michael's House. But underneath all of that, there will be a blend of workers from all the different types of agencies. So it keeps, to me, it makes more sense that all of this is brought back in, funded properly. The workers are paid and treated the same way, and then ultimately then the citizens get the better service as a result.
Yeah, I saw a news report on Virgin Media News a month or two ago about this plan from the point of view of the parents. Some of them in South Dublin, I think, were very angry about the changes. Some of the changes as regards how it's going to affect their kids. I know a couple personally of health professionals working on implementing progressing disability, and they are very doubtful it can be implemented properly because first of all of the lack of funding, but also because it means that the staff that are working on it at the moment will have to do a lot more extra work. Can you tell me, Catherine, what your members and other people working in the sector are telling you about the implementation of progressing disability?
Exactly, Darren, you've summed it up there perfectly. As a plan, it is a good plan. It makes sense that a parent can access all the services they need, but to implement it and deliver it, you need to get much more health and social care professionals employed by all the agencies. And this problem with progressing disabilities moves beyond just the funding issues for Section 39 agencies and community and voluntary sector. There's a huge has been a huge underinvestment in health and social care professionals within Ireland. And when I talk about health and social care professionals, that would mean there's 27 professions in all. They're regulated by Corru, most of them. But when people think of healthcare professionals, they often think of the nurse and the doctor, and they don't see all the other professions that you will meet in your own life as you access services. So physiotherapists, occupational therapists, speech and language therapists, dietitians, orthoptists, the list goes on, audiologists. There's all those services that are so vital it's particularly in progressive disabilities. Early intervention is so important for children. So if a child has, a developmental delay, they need access to all those services. And the biggest problem is not the plan for progressive disabilities. The biggest problem is not resourcing it properly, not having enough workers to provide the services. And people often hear about recruitment and retention issues in nursing and the high turnover because of conditions in nursing. When a report was done, I think we're going back about 3 years now, the highest turnover in staff in the health sector, the highest turnover was actually emergency doctors working in the emergency department, and the second highest turnover was health and social care professionals, because for the reasons we're talking about here, because these dedicated, highly trained, highly committed professionals could see that with the numbers of staff working at the moment, they couldn't get to provide the services that they want to at the high level. So that's the key issue and that's where parents would worry about services, that while it's a really good plan to have, like a one-stop shop and for parents to be able to access it, you need to have the funding, the staffing, the resources behind it.
Okay, and is progressing disability the main thing you personally are working on, or are there other kind of plans in the health service as well in your area that are in a similar position, like?
Yeah, and it feels probably, Darren, you feel like I'm constantly just talking about funding and looking for funding for healthcare professionals, but ultimately for me, the strength of the society is how it looks after the most vulnerable within it. And another issue, and I'd say some of your listeners are probably aware of it, is the assessment of needs is covered under the Children's Disability Act from 2005. And under that act, any parent who makes an application to have their child assessed for, it's basically that assessment of what needs they have. It has to happen within 3 months, and the act is very clear on that. But again, because the HSE hasn't invested in the health and social care professionals that deliver that service. So if you have a suspicion or a worry or a concern that your child might need help in terms of autism, for example, or maybe displaying signs of autism, you will go to your healthcare professionals and you will seek an assessment. So what was happening was, even though people have a statutory right under the Disability Act to get that assessment done within 3 months, the waiting lists weren't 3 months long. They weren't even 12 months long. In some areas, they were 18 months long. They were 2 years long. So, if you're looking at a 3 or a 4-year-old, by the time they were getting assessed, they were 6 and 7 and already in school and already missing out on supports that should have been put in place. So the HSE was taken to court on a number of occasions by parents, naturally trying to enforce their statutory rights to have that assessment take place. So the union we work with all our members who would be that provide those services, so the psychologists, the OTs and the SLTs, the physiotherapists, all those grades that provide those services. So probably 2 years ago, the HSE decided to bring in a preliminary team assessment, which would mean that if you wanted your child assessed, the full assessment mightn't take place for 2 or 3 years, but they would, to meet the HSE's obligation under the Act, they would have a preliminary assessment. So that would happen within the 3 months. But our members have told us, again, and similar to points you've raised to me already, our members have told us that there's not enough time within, a 90-minute session to fully assess and determine a child. That could take 10 hours or it could take 15 hours. So what they're seeing is the HSE taking a shortcut to meeting their statutory obligations, but not fulfilling the full needs for the child. So we're working with our members and the HSE at the moment on a review of that whole process. It's been chaired by a man called Robbie Ryan, and he's met with Minister Rabbit on that. So we have representatives. I sit on that review group, but we've also got representatives from the union members, from all the professions. So we would have somebody from psychology, from physiotherapy, meeting with HSE management to see can we do it better. So that's another big area of work that we're working on at the moment in health.
Okay, I won't keep much longer, Catherine. I know that you personally, you kind of work on health and that sector full time. Are there any other areas in the community voluntary sector that Fórsa work with that are also kind of like in a similar situation on the verge of collapse?
The ones that we would worry about, and they would be looked after by my colleagues in local governments, tend to be the homeless agencies that are very similar. So I wouldn't know the details, but I can tell you it's set up in the same funding model. It's under Section 10 of the Housing Act. And again, as I keep saying again, everyone is acutely aware of the housing crisis that we're facing and the homeless crisis that we're facing. So these agencies, again, need to be put on a statutory funding, need to be funded properly. We did a report back in 2015 called Caring at What Cost, back when we were Impact. We've had that report reviewed by a man called Brian Harvey, an academic from Maynooth. And as part of that report, he didn't just look at the health agencies, he actually looked at the homeless agencies too. And we're going to be launching that report when it's fine. It'll be finalised in the coming weeks, and it's going to be launched in July. And we're hoping to present to the Dáil on that, because it's, as I say, I'm talking about health predominantly this morning, but it goes beyond health, it goes into, as I said, into local governments, into agencies like that.
Okay, Catherine, to come towards the end of the interview, you've already spoken about what the solution to these problems are, but can you tell me how realistic do you think it is that the problems will be sorted out by the current government anytime soon?
Well, I suppose with all these things, it takes a determination and a will. It could be solved tomorrow. And we had Fórsa met with, we were lobbying all the politicians from the health spokespeople from each of the various parties. It's an initiative we've started in the last year while we've been working from our kitchen. So we've had a number of Zoom meetings with the politicians. So the spokesperson for Labour, the spokesperson for Sinn Féin, for Fine Gael, for Fianna Fáil, and we've told them the Green Party. So, and we've had great engagement from the politicians, from people before profit. They've all come to meet us and they've all listened to what we've had to say. Our most recent meeting was at the end of May, and we outlined these problems. One of the politicians was saying, well, like it costs, we're spending 4 billion, for example, on this, and where are we going to get extra money? But I'm not convinced that they need to actually spend that much extra. I actually think that if you sit down and take a step back, redraw the plan, say, look, this is the money we have, this is the services we need. Yes, we need a little bit more to do it properly. But say, this is a small example, and my mother runs, she's the manager of a community playgroup, so it's not in health, it's a community playgroup in Kilmore West on the north side, near where we live. And at the moment, there's there's 2 of them working there at the moment. But she still has to, as an organisation, her organisation is funded through parents' fees, through Department of Education grants, through Dublin City Council grants, and through all these things. If she needs HR advice, they have, a member of staff might be leaving and she needs HR advice, she has to go and pay for that. If she needs for compliance, so she would need auditors, she would have to pay for an auditor. So, I think a way you could do it without spending huge amounts of money, if the government had a will to do it, we'll be looking at, say, the bigger voluntary organisations helping out the smaller ones, with things that they're currently paying for. And I think if you apply your minds to it, the services are there, citizens need them, they have to be funded anyway. Why not take a step back and see, can we design them and fund them in a way that's sustainable for all the services that are providing them? So that'd be my view.